for coming along to this workshop on the role of the VCSE sector in SEND improvement, learning from Locality's work on children and young people's mental health. As way of introduction, I'm Sam Gomsall. I'm a programme lead within the Health and SEND Systems Improvement team at the Council for Disabled Children, and predominantly I work on the RISE Partnership or the RISE Partnership programme, which goes into local areas and runs targeted interventions. Leon.
Hi everyone, my name is Leon Osbourne. I am Policy Officer at Locality, a national membership network for community organisations in England, supporting about 1,800 community organisations in their work locally.
Jennifer.
Hi everyone, I'm Jen Griffin. I'm the Designated Clinical Officer for SEND across Shropshire, Telford and Wrekin. And I think Shropshire and Telford and Wrekin are quite well represented on this call, which is nice.
We can have a local discussion. Samantha.
Hello everybody, I'm Samantha Ives and I'm a Short Breaks Commissioner for Telford and Wrekin Council.
Thanks. Lucy.
Hi, I'm Lucy. I'm a SEND advanced practitioner looking at quality and improvement in Wolverhampton.
Lucy. Rivka.
I didn't realise we were doing this. Hi, I'm the SEND Enfield manager, basically, with a bit of curiosity. And I also want to say hello to Sarah Thomas, which is a really good old friend of mine. It's particularly good to see you. I'm very excited. Thank you.
There we go. We'll go on to Sarah Thomas then.
Thank you very much. And I was very excited to see your name as well, Rivka. Lovely to see you still involved. Right, I'm Sarah Thomas. I'm the participation and operational lead for the Shropshire Parents and Carers Council, so the local parent carer forum. And as Jen said, Shropshire and Telford and Wrekin again.
Thanks, Sarah. Philippa.
Hi, I'm Philippa Robinson. I'm one of the Children's Commissioners for the NHSGM at Tameside locality.
Thanks, Philippa. And Victoria.
Hi, I'm Victoria Isherwood. I am a Deputy Designated Clinical Officer within the SEND Collaborative Unit in Cheshire and Merseyside, ICB. I'm also an Advanced Nurse Practitioner for CAMS, Specialist in Children with Learning Disabilities and Autism within St Helens CAMS.
Thanks, Victoria, and thanks, everyone. Leon, over to you.
Thank you very much, and it's great to see so many of you here. And yeah, hopefully you'll be able to get a lot out of this session. So as mentioned, so I'm from Locality, so National Membership Network for Community Organisations. On average, these community organisations provide about 13 different services, everything from commissioned adult social care to a large wind turbine community-owned wind turbine down in Bristol, and everything in between. They kind of do so many different things, and a lot of it is focused around the health and well-being of communities, and within that, the children and young people of those communities. And a big bit of work that we've been doing over the last few years. We are a member of the government's VCSE Health and Wellbeing Alliance, so doing a lot to represent the voices of small community organisations in health and care, working alongside system partners such as the NHS, agencies such as the Office for Health Improvement and Disparities, UK HSA, and the Department for Health and Social Care. And one of those particular projects in the last year or so has been on the role of community organisations and community spaces in supporting the health and well-being of children and young people. So I'll just share my slides and want to take you very briefly through that work that we've done. So that work ended in our Space to Thrive research on kind of the role of community spaces in supporting mental health and well-being of children and young people. So that was done alongside the Office for Health Improvement and Disparities and our partners Power to Change. So within that, we looked at a range of different things, but it was really kind of the reason that we ended up doing it was because so many of our members were talking about how the last few years has had a massive impact, massive negative impact on the mental health and well-being of the communities they serve, particularly its young people. A lot of them reported, as you'll see in some of the data that we collected later, kind of big negative impacts in the health and well-being of children and young people, and we looked at that across kind of a wide range. So particularly from 11 to 25, including those young people with special educational needs and disabilities, but many of the organisations we looked at were really providing support for children and young people at a much younger age as well. So for the research that we did carry out, it was included a literature review of a lot of the things which are out there on the role of community spaces in different parts of health and well-being, and kind of particularly on mental health. We did a national survey which covered a number of organisations across all regions within England. We had in-depth interviews and wider engagements with the VCSE sector and the health system, so both in-depth interviews with the organisations which run support services for children and young people, and people from the health system, so from CAMS, from the school system, and GPs, much wider as well. So kind of a lot of people fed into this Space to Thrive research. And I think what I want to do is just go through the headline findings. A lot of information on that slide here, but I will kind of give you an overview of what we found. And I think the overarching takeaway from this research was that community organisations provide a huge amount of community space across England. They provide a huge range of activities for children and young people, and often do so in spite of challenges and difficulties which they face. We looked at two kind of main categorizations of the activities which the VCSE sector has for children and young people. Firstly, that open access provision, activities open to anyone in their community, not targeted to a specific group, but designed to help young people be happy, healthy, active, to make connections. How we were looking at it as the center of the I Thrive model, if you've seen that. So the ongoing support for children and young people to kind of maintain good mental health. And then secondly, that specialist provision, often commissioned work, which kind of supports and carries out interventions for specific groups, people with certain protected characteristics, inclusion health groups, etc. So often kind of commissioned by local authorities and delivered by community organisations. But we know that open access provision, the demand for it and the demand for specialist provision has massively increased in recent years. Huge kind of amounts of referral into the VCSE sector, often into specific organisations where kind of the person doing the referring knows of them, so kind of sends children and young people that way. Community organisations are kind of, for children and young people, low or no cost. They are depressurized, safe, relaxed third spaces, as many people call them, for children and young people away from school or home life. Kind of those might be seen by some young people as sites of harm, but we see many young people really being able to engage with interventions in community settings. So differing terminology between the health sector there in terms of kind of community services. When we talk about it, we mean kind of those services provided for people living in a particular area by community organisations in that area. And we know that there has been kind of a gutting of open access services. Those services which were around kind of 10 years ago, many of them have closed. Budgets for kind of youth and play grants from local authorities, all the different ways which community organisations used to get a lot of their funding for open access provision has disappeared. And so there's kind of a big threat both to the open access provision and obviously specialist provision delivered by community organisations, we are also seeing that there are difficulties for some VCSE organisations wanting to go down that route, whether it is kind of difficulties in commissioning processes or kind of meaning they don't want to go down the kind of competitive tendering route for kind of getting income. So, as I said, these VCSE organisations providing incredible services for their communities, for children and young people, but with those significant barriers and challenges which they face. Now, community spaces create positive impact. That whether that's kind of increased social connection, increased resilience, additional knowledge and skills, improved relationships with other children, young people, or their families, reduce isolation and loneliness. We know that kind of through our research, these were kind of some of the really big positive impacts reported by VCSE organisations across the country who are providing services for children and young people. And as I said, those challenges which they face include kind of being used as waiting rooms, as one of our members put it, for public sector services. So we know that in some places the CAMS waiting list, 18 months, 2 years, it can be a really, really long time. And in order to kind of offset some of that, we see kind of community organisations becoming kind of holding spaces for young people who can support them, who do support them, but they are not specialist organisations. And in many cases, many of these young people have kind of multiple and complex needs which aren't necessarily being supported. So in some ways, community organisations are doing two different things. They're helping young people to be kind of happy, healthy, sustain their mental health, but also trying to support children and young people with increasingly complex needs. So some of the headline data that we collected, I don't think any of it will be of much of a surprise to anyone, but so the vast majority of respondents to our national survey said they'd observed the mental health and well-being of children and young people they work with worsening or significantly worsening since the beginning of 2020, obviously pandemic having a big impact. Over the same period, 87% of them said that kind of they'd seen the demand for their provision for children and young people increase or significantly increase. So kind of a really big issue happening there in terms of capacity of these organisations. And then thinking about community spaces and the impact, as I mentioned, so you can see on the graph there, reduce isolation and loneliness, increase social connection, really, really big, important kind of reported impacts of the work carried out by community organisations. So where does SEND kind of fit into all of this? So community organisations are a vital part of the support ecosystem around children and young people. They aren't the sole place for interventions. They are part of the jigsaw. And when we asked community organisations whether they provided services for SEND children and young people, the majority of them kind of said, oh, well, of course we do. And 54% said they kind of provided some form of service to SEND children and young people. And when we looked at what services they provide, a lot of that wasn't the specialist services. It was the open access provision, open to anyone, but where they made sure that those services were accessible to SEND young people. As somebody in the last workshop said, so many young people don't want all the activities they do to kind of be in the SEND box. Is a really, really important part of kind of interventions and kind of activity happening where children and young people can be supported in their mental health without it being kind of badged specifically for SEND. These are open access for anyone. And when we look at kind of the difference of kind of where different interventions are happening, these third spaces are really, really important. That, as we said, relaxed, depressurized third spaces. We saw how important that was for interventions and what an important element it was described to us as by those within who took part in the research for young people who struggled at school or those who had any other kind of additional needs or kind of complex needs, multiple needs. having that kind of sight away from statutory provision in which they could speak to somebody, in which they had some different form of connection, was really, really important. So we've kind of see the kind of the challenges which are there of kind of that joint working. Funding, obviously a problem, lack of recognition, referral issues, high demand. I think that there's something definitely shared with a lot of kind of frustration between the VCSE sector and the public sector, where both face increasing pressures when it comes to funding, both have increasing pressures when it comes to capacity to start these conversations and things like that. So kind of big issues there to deal with. And I mentioned referrals as well. That kind of that lack of recognition of the VCSE sector in many areas, or kind of just a lack of knowledge or awareness of what is out there for children and young people, especially for SEND young people, is increasingly an issue. So we spoke a lot with those participating in the research about the SEND local offer, and how many of those organisations didn't know that, who were providing services, did not know that they could be on the SEND local offer in spite of providing vital services for SEND young people. They kind of are frequently left out of kind of the shopping list, which is there for kind of people using personal budgets when in terms of kind of social care, especially when you kind of get to the 25 plus age range, and kind of that inclusion, the inclusion of the VCSE in that kind of wider ecosystem is so important, and the support of the statutory sector is so vital in that. So just one of the case studies that we included in our Space to Thrive research was on St George's Community Centre in Loopsett in Wakefield, so one of the most deprived neighbourhoods in the country, where from their centre, St George's operate a huge array of provision, both open access provision and specialist commissioned provision, and they provide direct kind of SEND support to young people up to the age of 25. They have tailored groups through and different kind of specific programs, as well as inclusion in the regular program of activities. And they offer everything from kind of just a space to play, to chat, to make connections with other young people, to a hot snack, Wi-Fi, signposting, informal drop-ins, etc. And kind of the kind of mantra which they have is kind of, we pride ourselves in being accessible and representative of all members of the community. So I think just that coming through again, that really, really important point that community organisations are there to serve everyone, and they really do so through their services. So as part of the Space to Thrive research, we had a number of recommendations, so kind of based on our findings, aimed at kind of all parts of the health system and local authorities. So primary care networks, integrated care systems, local authorities, and national level. So recommendations in 4 key areas. So resourcing community organisations, making sure that they had the capacity and capability and funding to keep these incredibly important services going. Culture change and collaboration, making sure that the VCSE sector was being supported to collaborate, and that there were opportunities for collaboration between sectors. We have the workforce development, so kind of those working within the youth sector, so youth workers, play workers. We know that has been incredibly difficult to hire them, and retention and churn, really big issues as well, in terms of making sure that there's consistent support for children and young people. And then we have our policy priorities and development, so making sure that the role of the VCSE sector in supporting children and young people, all children and young people, is a national priority, and that kind of the big funds which are out there are going towards supporting these areas. And in particular, we had one recommendation which was to encourage better use of the local authority send offer. This was a really big thing which came up in the research of these, particularly the small local organisations, not knowing what the send local offer was, not knowing that they could be on it, not knowing how to best support children, young people, especially send young people in their local area. And also kind of vice versa, making sure that local authorities, primary care, schools, make sure that they knew what was happening in their area, that information gap which exists, really, really important. So in just a moment, I will stop sharing my slides and I'll share the link in the chat to the report, so you can have a look at that. But just wanted to leave as much time in this for kind of questions and reflections and discussion. So yeah, I'll firstly take kind of questions and reflections from you, and then we can either see where the conversation goes and we can ignore these questions, or kind of have a bit of a chat, kind of what challenges do you face in working with the VCSE sector on send system improvement, and what solutions do you think there are for harnessing kind of the power the VCSE can have in terms of send improvement. And I think Sam has just popped those in the chat for us. So I'll stop sharing my screen and leave some time for questions and reflections, and I'll just grab the link to the report so that I can share that with you now, and go to Sarah.
Thanks. That was really helpful and timely, I would say. So definitely be having a read in detail of the report. I think a couple of things that struck me. One, while there are a significant number of young people we send who, as you say, want to be part of just the everyday normal things that go on in their community, I think there are also a group that specifically need a very particular offer, and also and ideally that still takes part in the community so that they're visible, and that they're but it's about having a different type of offer but within the community, so it's close to their homes, close to places where brothers and sisters go, so people become visible. And I think particularly for those young people who have a higher level of disability, they're often not very visible in our communities, and enabling them to be so is really important for a long-term societal culture change. So sort of I just wanted to make that reflection on what you said, and sort of hope that we don't lose that side of it as well. Just to answer one of your questions, we are a voluntary sector organisation. We're a parent carer for and foremost, but we do deliver a community support offer as well. And I've also worked with our local VSA for a long time as well. Sorry, Voluntary Sector and Community Assembly. And one of the challenges are working with either the local authority or the health system is just the complexity of the commissioning process and contracting, and the level of expectation in terms of contract management that is placed on very small organisations, and that is a real challenge for the voluntary sector.
Absolutely, yeah, and it's something we at Locality have been very, very focused on in terms of kind of commissioning and what it looks like, and which I think comes to your first point about how do you make kind of that kind of taking services which are needed into the community. Part of that is about making it possible, making it easy and simple for these organizations to deliver contracted, commissioned work in the community, and I think that's part of the solution to making it visible, to kind of getting contracting done at neighborhood, at place level, where people are.
And it's not about not wanting to be held to account, or not wanting to, create an evidence base or report. We're very happy to do that. But some of the, we had a contract we have a partnership with another voluntary sector organisations. The initial contract that was sent was like 170 pages long, and our partner organisation, who was taking the lead in the contract, had to pay for legal advice to go through that contract, which, you know, actually was just taking valuable resources out of the community, you know, that could have been used to support the community. So yeah, it's a challenge.
Absolutely. And I'll be cheeky here and plug Locality's Keep It Local campaign, which is all about all about that. And we have a guide for commissioners on how they can do local commissioning better in terms of supporting the VCSE sector, which definitely feeds into there. So I feel entitled in saying it. Yeah. Any other questions or reflections?
Yeah, I had a question. I'm coming from a more ignorant place because I've got a curiosity beyond just being part of SENDIARS. I mean, I'm very conscious of how much external influencing factors like this are making a difference to our young people, including my own children. But my question is, and pardon my ignorance, is apart from obviously the formal commissioning that has to take place based on where the funding comes from, are there other alternative funders, to gain grants, which means the process of getting something is less complex, even for smaller projects? That's my first question. And if there is there a forum to sort of where that's shared, right? And the other question I had, I'm going to just lose it in a second. Oh God, I just lost it. That was my first question. The other one is going to come back to me, but it's just gone. So maybe I'll address that one first. So when you're talking to me, I mean, it might be just a case of ignorance. Maybe you're very specifically honing in. Oh, I know what I wanted to ask you. Through your research, did you create some places which are model practices where it's working better, and where they have found a solution to sort of kind of really hone in on making this work? Because as Sarah said, it seems like the process to get that funding is a massive burden. And it's compromising. Yeah. So those are the two questions that kind of sort of interlinked.
Yeah. So I guess, yeah, to take the first one, there are other sources of funding out there. I think our members find those increasingly hard to find and competitive. So they're still having to put a large amount of resource into trying to find this. So sometimes some funding around a particular youth project or something might come from the local community foundation, or one of the priorities for the government's dormant assets fund is around youth. So there can be there are funds out there and things like that. But in terms of long-term sustainability, where you're bringing together the VCSE sector with the other parts of that kind of formal ecosystem around children and young people, it's so important to make sure that the health system is connected with the school system, is connected with the VCSE sector, etc. So kind of having kind of the funding coming from the health sector, who are often looking for the exact same outcomes for children and young people as voluntary sector organizations are already providing, is kind of a really, really good way of making sure that there is that integration happening between sectors, so that it's not just kind of discrete pots of money for different bits of activity necessarily. And in terms of your second question, in terms of kind of model practice, we weren't able to do that kind of through the project. There are, and we've kind of tried to include kind of case studies in the report, and I can certainly happy to have a discussion with you about it, but kind of areas where it is working, where where kind of community organizations have been able to access this type of funding, and where it is really working. And we had a really, really good kind of roundtable sessions with places like Holton St Helens, and actually a colleague from, I know there was somebody from Cheshire and Merseyside on the call, but we had a colleague from Cheshire and Merseyside, ICS, kind of talking about kind of the way in which they have managed to convene community organizations, community groups alongside health and alongside schools and things like that, to kind of make sure that the discussions are happening locally. Not a solution, but kind of a way of working towards that solution. But yeah, there are some hopefully some examples which will be helpful in the case studies in the report.
Thank you.
Samantha.
Hello. I think a lot of it depends on what's in your local area. I feel very spoiled about working in Telford and Wrekin, even though I've got Iron Bridge in the background. Recommend you go and visit. Telford was a new town in the 1960s and consequently has got a lot of community centres built around all of the building projects that happened to create that new town. And what that means is the council recognises the value of social capital and using and connecting into communities. So what we did when we stopped managing those community centres was enable local people partnerships to run those community centres. So I've got a lot of partners that we work with. The local authority has got quite a mature relationship with our with our parish councils and chief officer groups and those sorts of things, and we commission quite a number of significant services. I absolutely take the point about making sure that the commissioners don't overburden small organisations with huge amounts of administration, and that's about, I guess, being intelligent about your commission, your procurement. The other point, just before I come to my question, the other point as well about the health authorities, ICBs, now wanting to link in a lot more with the VCSE sector is really, really great. One thing I would say is that I would really caution about those ICSs setting out to create a new set of infrastructure and governance around doing that. It's about joining in with systems that have been in place for a very, very long time, because I think governance will then take over and create an absolute mess of things, won't it? So the question or the comment I wanted to make was about, I also take the point about making sure that sessions are inclusive, but also sometimes you need something that goes a step up from that. And sometimes I find that community settings will either under or overestimate their ability to do that, and then I get lots of complaints from families about that. So how can we do that? Is that been your experience, and how can we do that in a really sensitive, pragmatic and purposeful way to really make sure that we get the needs of these young people understood so that their outcomes can be met and they can be safe?
Absolutely. I think that is so important. And I think what we have said, and I think what we saw through, well, the discussions and roundtables that we had, that communication and discussion can't be underestimated. Kind of making sure that these organizations are given the training, given kind of access to the expertise, having where people within the council who have the expertise of what these services should or could look like are able to advise the voluntary sector of, you could tweak this in your existing provision and you'd be able to make it so much more accessible for so many different people. And I think voluntary and community sector organizations are so open to that, to being able to tweak things and make sure, because they're there to serve their communities, they don't want to be excluding people. So I think, and if it's a commission service, having those discussions early, kind of making sure that they're brought in as part of kind of discussions, if you're going down the kind of the procurement commissioning route, having pre-procurement, pre-commissioning conversations with the local sector to see what the gaps are in their knowledge, so that they're not overestimating or underestimating their ability to deliver something. So making sure that that process of discussion and designing a service comes very early, or if it's kind of a completely separate service, going to them and having that really open, frank conversation of, you could do this to improve your services, which would be able to support this particular cohort or this particular set of individuals with these needs.
Sure, and there should be market engagement, commissioning speak, even before a tender hits the patch, doesn't it? But also, just because I'm a commissioner doesn't mean I will use my formal specialist commissioner mechanisms, I might ask our community participation team to do a fit for purpose grant system that will get the service we need and doesn't overburden.
Yes, and we're very much down the on the side of, if it can be a grant, it should be a grant.
Absolutely.
At Locality, because as you said, that burden that we discussed, kind of that it can create through a formal kind of commissioning or procurement approach.
Can I say one more thing as well? It might be for
Absolutely.
benefit of everybody as well. Our local authority, our community participation team, who supports all our community centres, has recently created a kite mark for youth support, which also includes disability awareness and further training as well. So that's just been publicised, and we've got our first sign up. So I work closely with those guys, and I keep my commissioning feet out of things if they're not needed, because those guys are doing that, great job.
No, that sounds fantastic, and I might have to be in contact, because that sounds like a really great example that we would want to share with our network.
Sure. Pleasure.
So just want to very quickly kind of just close with some final thoughts, just in terms of kind of things I hope you'll take away from the workshop, just in terms of community organizations being just a really vital part of that ecosystem in communities for both adults and children. And kind of, I see some of the other workshop titles kind of being the key ingredients for SEND local service improvement. I think that the VCSE sector is a really, really key ingredient in that. Kind of, they're rooted in their communities. They understand what's there. They have that local level of intelligence. They know what is missing in their communities. They know what is happening, and I think that's so vital for interventions to happen, which are kind of truly successful. So engage with your communities, talk to them, talk to VCSE organisations, include them in the local offer, and I think can't go wrong with any discussions like that. So I'm just going to pop my email address in the chat, so if you do want to get in touch, that would be great. If you have any questions about the research or about Locality more generally, please do get in touch. We'd be more than happy to talk with you. So thank you very much.
Thank you so much, Leon. That was really fantastic. That was great. I'm going to stop recording now.